Hello and welcome to our webinar. If you were joining us today, our webinar is Boswell's Journey, an Avian Cancer Survivor Story. Well, first of all, we'll start this off with a little poll question while I wait for people to log in. But you are hopefully at the right webinar. We are Boswell's Journey, an Avian Cancer Survivor Story. Okay, so here we go. While we wait for people to log in, I am going to launch this poll, and it is lots of areas around the nation. We are going through some heat waves. So how does your bird cope with the summer heat? And your potential answers are, they use their water bowl as a bathtub. They stay chill in our air-conditioned home. I keep the spray bath bottle at the ready, and heat doesn't seem to bother them at all. So I'm going to ask our guest today, who's also looking at these poll questions, Dr. Jörg Mayer. So are there any bird species that the heat just seems to not bother them much at all? Or are they all about the same?
Well, yeah, good question. I mean, if you think about it, it's all about natural history, right? So if you have a cockatoo from Australia that is used to very arid conditions, right? If you're an African gray, right? You probably deal a little bit better with longer periods of hot and dry climate than if you're an Amazon, right? Because it's just basically built into your DNA. Because if those birds that didn't cope well with the extreme heat and a prolonged period of an arid condition, they didn't make it in the evolutionary history. So that's why, one answer doesn't fit for all of the species that we have. So basically, if your bird is from a warmer climate or where humidity sometimes drops down to 15 or 25%, which is a desert climate, so then they deal with it. Not to say that this is good for them and you shouldn't be constantly doing this, but they can probably cope with it much better than if you're a macaw and you're used to daily rain showers.
And now, is there too much water that a bird, like if your bird's sitting in their bath, like, can they have too much water?
Well, I'm a big fan of, again, I'm always saying it's like if we take any animal, that is non-super domesticated, like our dogs or cats that have been living with us since, prehistoric time. Like what we need to do is we need to give them the ability to regulate that behavior. So would I recommend to constantly take that mist bottle and spray that bird every 15 minutes? It's probably not what happens in nature too, right? Because that is probably not a great place where birds are super happy if it constantly has a downpour of every 15 minutes. But other places where it rains twice a day, absolutely, right? So if you have like a mist bottle and you want to spray them for 5 to 10 minutes twice a day, absolutely. And besides that, these animals are extremely smart, right? And so they'll figure out, I always say, just like we all have had these days where we suddenly got up out of bed at 1 o'clock at night and, like you just kind of like walk to the fridge in a half kind of sleep mode and you put yourself a glass of water or whatever. That's not a conscious thing. Your body basically tells you it's like you're thirsty, go to the fridge and get a drink, right? So, and these birds, those reptiles, all those animals are extremely efficient. So what we have to do is we have to give them an opportunity to have a little bath. If they don't feel like they want a bath, they're probably not going to do it, but maybe they go over there and take a sip. If they feel like they want to take a bath twice a day, well, just make sure that this is a possibility. Again, just like you want to live in an apartment that has a fridge and you don't want to have you don't want to be dependent on someone ringing the doorbell twice a day to give you a bottle of water. So it would be the same thing.
Okay. Thank you for that. That was good insight. On our poll question so far, so the question is, how does your bird cope with the summer heat? Answer 1 is they use their water bowl as a bathtub. We have 18% of respondents selecting that. They stay chill in our air-conditioned home. That is 55%. I keep the spray bath bottle at the ready. That is 9%. And then heat doesn't seem to bother them at all. That's 18%. So there we go. I'm going to end the poll and we can see the official results here. There we go. Yay. Okay, thank you all for answering our poll question today. And now we will move on to the topic at hand, which is Boswell's journey and an avian cancer survivor story. So our special guest, you've already just met him a little bit, that is Dr. Jörg Mayer. He is an associate professor at the University of Georgia College of Veterinary Medicine. He is also the past president of the Association of Exotic Mammal Veterinarians and co-author and co-editor of Clinical Veterinary Advisor, Birds and Exotic Pets and Exotic Pet Behavior. So, Jörg, I'm gonna let you take this away. We are dying to find out about Boswell and the journey that he went on. So if you can give us some insight on that, we will definitely be all ears for you. So there you go.
Cool, excellent. So let me do that screen share, bring up my first slide. There we go. Can everybody see that? Yeah?
I can see it, yes.
Okay, cool. So yeah, first of all, thank you guys for taking time out of your busy day to listen to me. Hopefully my thick German accent is not in the way. And there will be a question and answer session at the end. So feel free to fire those off. I guess I will go through the case and hopefully it's entertaining and informational. That's how I like to deal with my students. I want to make sure they have a good time while I educate them. So buckle up, it's going to be a fun ride. So basically, wait, boom, boom, there we go, that's the right button. So, okay, so basically what I'm gonna do in the format that I'm gonna pick here is I'm gonna try to present that case as it developed. So it's a little bit like a, kind of like we like the murder mystery thing. So I'm gonna keep you involved in it, that you maybe get a feeling for the case, how it developed, but also what I want you to also appreciate is I want you to see how we come to decisions, how we make decisions as veterinarians, especially when we have a case where there is not a lot of information out there, where it's not as easy as open somebody's book and read on page 48 till 52 how this is going. And to be honest, these are really the cases that fascinate me, and that's why I love my job. And maybe that's why I also ended up dealing with exotic animals, because I found that for the vast majority with dogs and cats, there's probably already 2 books written for every topic that you can think of. So versus we kind of like confronted a lot of times with either a new species that we don't know that much about what they are predisposed to, what diseases, or, you know, we have a new presentation in a species that was like, I've been doing this for 20 years. This is the first time that I'm seeing this. So to me, that is really what keeps me coming back every day to work. What I also love is that I think as an exotic animal veterinarian, you have to have a certain affinity for risky behavior. If the uncertainty, if that threatens you, you're probably not going to thrive in that condition, because like I said, a lot of times we are a little bit in a scenario where there is no book chapter written, where the only information is literally a phone call away, because you know that your other colleague has seen some of these species and maybe that person has an idea of what's going on. Also, I really enjoy talking to my clients, working with my clients. I always try to teach my students that, you know, whatever you do, it has to be a team approach. You can't just march in like the 5th Army Corps and say, this is what's going to happen, you know. It's a team approach, and I think these cases are the epitome of it, because you literally have to be honest and say, hey, Mrs. Smith, to be honest, this is like the first, and so we're a little bit blunt, but here's our thinking, and then what do you feel like doing? Some people are very risk adverse. They don't want to do a surgery. They don't want to do anything risky, and that's okay, right? Yeah. And so then we come up with a plan B. And so as long as everybody's on the same page, then that case hopefully is successfully manageable. So I'm going to try to take you on this journey together.
Okay.
So basically clinical presentations. So this was the first time that I met Boswell. And he presented to the clinic with a 1 week of history where the owner just said, you know what, he's not doing that right. And he said he has he's intermittently lame. And so sure enough, and we all know how non-specific these clinical signs are in birds. So, all right, so he actually drove fairly far distance. So that case was actually from 2008, so a few moons ago. And I think I remember they had a good over 2 or 3 hour drive in the car. So, but Boswell was a really good co-pilot. He was sitting on the passenger seat. He kind of was refusing to wear a seatbelt, but you know, I think one day the owner got actually pulled over by the police, and they find it kind of too amusing that there is a gray goose on there. But once he sat there on the way to the hospital, he was on the way, and the trooper didn't give him any hard time. So that was cute. But basically, it's interesting. So he came. He obviously walked into hospital like this, and so we examined him. And, you know, we gave him a good physical exam. We didn't really appreciate a swelling anywhere. And, you know, we did kind of like the trotting exam like they do for horses. You know, we had Boswell run up the hallway and down. Basically, he just had to follow the owner. He was obviously heavily imprinted on him. And so, but we could really not appreciate kind of like honest again. So he said, you know what, you drove all the way and we obviously want to take you serious because we don't think that you want to just like waste your money here. And so we took radiographs and we didn't see anything. I'll bring them up in a sec. And so basically we didn't see any major orthopedic issues. So the differential diagnosis at that time was, you know what, he spends a lot of time outside. He had a sister. The owners also had a couple of dogs. And so maybe, you know, maybe they were chasing each other or, you know, just could be that there's a soft tissue. So we did prescribe some anti-inflammatory medication and basically said, hey, good news is we can't really find anything in the bone, in the joints. And maybe, you know, something happened that you were not aware of, and it seemed like, okay. So the owner said, okay. They went home and literally the day after they were home, he was lame again. And so again, that was, I think, in 2008. And so think about it, that was just, I think the first iPhone came on the market 2006. So, you know, there was no FaceTime, there was no Zoom. Obviously, this was like really in this, you know, infant stages. So, but we had YouTube. So I basically asked the owner if he can film this and just put it on YouTube. Today, I would say, send me a little movie clip, but oh well. And so sure enough, this was the little movie, and you can probably still find it. So, and yeah, hands down, you know, there is he is lame. You know, this is a good recommendation that I can really give everyone out there, that if you notice something wrong with your bird, like, grab the camera. If it's an unusual behavior, if it's something that, you know, that you are worried about, worst case scenario is, you know, everything is back to normal and you can delete that file, right? So there's no problem with recording anything that worries you, or keep it on file. If it happens again 2 weeks later, now you have 2 events. So sometimes we do struggle a little bit when we have birds brought in as an emergency where the owner states that the bird has a seizure, and you know, we keep this animal, we examine it, everything looks perfect, the blood work looks perfect, we can't find anything, and so then it's like, please describe us the seizure, right? I mean, so. Yeah. And then it's really difficult because maybe you have been nervous, maybe, you know, so, and to be honest, like describing really a seizure is actually difficult, even for somebody who knows what they're talking about, versus you have a movie that potentially shows that. It helps so much. So that would be my recommendation for anything. Take that little movie, bring it with you, or if it happens later, send it to your veterinary office. We always love that stuff. Okay.
It's a great suggestion. I think that's so handy. Wow. Didn't even think about that.
So then, of course, you know, that didn't go away, because otherwise that would have been the shortest presentation and the most boring presentation in the history of avian medicine if the carprofen would have done it. You know, so of course, you know, it didn't get better. So then Boswell came back, and these pictures are all from the owners. This is really Boswell, right? The owner was canoeing and Boswell was always there with him. So he obviously returned for more severe lameness on that left leg. It was the same leg. So sometimes you have a lameness on the other leg. No, but it's the same leg. But it actually this time was more severe. Yeah, he's still eating well, but obviously intermittently he doesn't want to swim as much. You know, he doesn't want to come running with the dogs and stuff. So clearly the owner notices a change in behavior too. Guess what? After the 2.5-hour car ride in the hospital, he is a poker player, right? He's like, what are we doing in this hospital? This guy's a German accent. I don't like him. What is going on? I'm totally fine. Can we please turn around and go home, right? We all know birds love to do this. They love to hide their symptoms, especially if you're a prey animal, right? Because evolutionary, it doesn't make sense to show weakness because that's exactly what the fox and what the coyote is focused on that animal that is lame, right? And they know this. So the word got out. So once they're stressed, once they're in a strange environment, once they listen to somebody like me, they will do everything to hide that, you know? So interesting. So I said, not a surprise, but we'll repeat the radiographs again. Owners was, I mean, again, that case was only possible because he had the most amazing owner. So, you know, because as you know, all of this stuff costs money. So here, and we have the pictures for March. Can you see my cursor? Is that visible?
Yes. Yes.
Okay, cool. So you see the picture from March here, and you see from May. And now this was obviously the second presentation. And if you look carefully, and I hope you can see it on your screen at home, you see this little blip here. Is that visible on your screen?
I can see, yeah.
There's a little shade of gray. If you go over again, this is a superimposition of the skin here, so ignore that. That's the skin, but there's definitely something. So again, there was a little bony change right there. Okay, so very subtle again. So then we take the other view, and maybe you see it a little bit better here. So so it was kind of interesting to us because, as you see, it looks like, you know, somebody placed a chewing gum on a lantern post, you know, and most of the time when we have bony lesions, they usually involve the original bone a little bit more. So you see that structure maybe a little bit eaten away, or, you know, versus we don't really see anything of that original bone. It just literally it looks like an attachment to the bone, but it seems bony in appearance, okay? So we said, hey, there is clearly something happening. So what we did, because we're at a university, we have all these high fancy things. We said, you know what, a really good way to look at metabolic activity, if there is any kind of cell turnover, is there something kind of changing? Something called nuclear scintigraphy is really great. So basically what that is, you take a little bit of radioactive substance and you inject it into the bloodstream, an IV, and then basically if an area that is metabolically active, it means there's a lot of blood being transported too, because as you can imagine, if there is more bone being built, it needs building blocks, right? How does the building blocks, the nutrition get there? And that's with the bloodstream. And so basically, when you do a scintigraphy, you're looking at any kind of tissue that has a higher level of blood supply than usual. So it's not a very specific, it's not going to give you a diagnosis. It's not going to say, oh, this is a tumor, this is an inflammation, this is, but you know that there is something happening at a faster rate. So the animal needs to be completely still for this. So basically we have him here intubated in a gas anesthesia. He has an IV catheter in. And so basically he's lying on this table, and over there you just see the edges of it. This is what's called a gamma camera. So this huge camera, it's either above or it's underneath the table. What it does, it's basically kind of like a Geiger counter. It basically just records the radioactivity, you know, and then it says, oh yeah, this is really a fast turnover site or not. And as you see, it kind of lights up here like a Christmas tree. You see actually the joint a little bit here has a little bit more blood supply because he's using that leg differently. That means that he's putting maybe a little bit of a different kind of angle gate to it that irritates the joint. So it like would get a little bit of an inflamed joint. And so we see this. But this just tells us, wow, this is really, really active. There's a lot of blood going in, which a lot of times is not good news, right? So again, like I said, this doesn't give us a diagnosis. So it just tells us there's something going on. What I did with this image is now that's that radiograph that I showed before, where we see just barely, you really have to scan it very carefully. But then what I did is I superimposed that scintigraphy over it, and you see, boom, it really matches up. So this is right where that change is happening. Here you actually see the radioactive material being excreted. These are the kidneys, okay? So, and there's the cloaca already. So, sorry. So basically, but the kidneys are usually very, very active because they have to excrete all this waste stuff. So if you compare this to the kidney, you just see how active that lesion is. And like I said, that could be either a really, really bad inflammatory process, and that would explain also painful, or it could be something like a cancer, okay? So basically what that meant is, like, in order to get a diagnosis, we'd have to take a little piece out and look at it under the microscope. And, every talk has to have a little histo picture on, beautiful slide. So basically what it came back is that these are this is bony cells, and they're just randomly placed. And there's a couple of factors in there that basically gave the diagnosis of osteosarcoma. So as you probably know, every time a tumor ends with sarcoma, it's bad news. It just means that it's a fast-growing, undifferentiated, kind of like aggressive tumor, versus if it ends in an osteoma, if it would be just an oma, it is usually a little bit better news, So we knew, but we already knew from the clinical behavior, this is painful, this is aggressively growing, and it's one of those bad tumors. So then when we look into the literature, what do we know about osteosarcomas in birds? Because as you can imagine, it's really well studied in humans. It's actually fairly well studied in dogs. So, but when it goes to birds, we have very little, at least at that time, 2008, very, very little information. That first one is a case report where they basically just described an osteosarcoma in a robin, that they performed a necropsy on it and they found it. So it was kind of like, oh, gee, look, birds can get osteosarcoma, interesting. So, at least somebody needs to be the first one to describe it. But also, if you look at the publication, that was from 96. So, some diseases in birds were described in 1896. So, but this one was one of the first ones, 1996. And then there's another one, and basically it just says, yeah, they can. It's also sarcoma, so it's bad news. But, we don't really have that much information from a clinical point of view. So, again, which is kind of a little bit sad as a clinician, because you want to maybe find out something that, oh yeah, this has been described 15 times and at least 5 times it responded and 10 times it didn't. So it gives you kind of an idea, but we were really kind of like scratching the surface here, because most of the stuff were pathology data, meaning that there was no treatment offered because it was an incidental finding, or the owners maybe decided to euthanize, or the bird died because it was already too far progressed. So then after looking, I found a paper from 1994 from a proceeding, from Avian veterinarian proceedings. And that person treated actually a blue-fronted Amazon. And again, the swelling was there on basically on the side of the eye. And it was 6 months there. Again, the biopsy revealed osteosarcoma. Most of the times, these lesions are not completely resectable because they're a little bit like weed. Like if you're in the garden, yeah, you can pull up that weed. But whilst you pull it up, you probably leave 10% of the roots in there. And then, a couple of weeks later, that weed comes back to say hello. And so it's a little bit with those sarcomas, because they just have their roots stuck everywhere. And this is why, for example, if you diagnose this in a dog, the oncologist will recommend actually, for example, if this is in the in one of the legs, the recommendation would be amputation of the leg, because they know that surgery, we can't just get good margins. And so we have to be very aggressive, amputate the leg. Obviously, in a goose, that was not an option, right? Because a one-legged goose, a pogo goose, that's not a good idea. So we would have bumblefoot on it. So, we said, Amputation, not an idea. So what we have to do, we have to treat it aggressively with chemotherapy. So in that case, that person used doxorubicin, which is commonly used in human and also veterinary medicine. And so basically that veterinarian used a dose basically extrapolated from dogs. And so again, this is like a perfect example of how sometimes we are really in the dark with these, because we don't really know what are the side effects of doxorubicin and in these birds. And as you can imagine, with chemotherapy, you got to be very careful, because the idea of chemotherapy is that you want to kill part of the body, but you don't want to kill obviously vital organs. So you're walking a very tight rope. And this is why if you look closely here at that slide, most of the drugs, when we talk about drug dosages, you're obviously familiar with milligram per kilogram, right? But with a lot of chemotherapy, we're actually using milligram per meter square. So we have to convert the kilogram into the surface ratio, because it seems to be a little bit more accurate when we look at it from the surface ratio versus just body weight. Because the smaller the animal, the bigger the surface is in comparison to the ratio, and also a lot of times the bigger the metabolic rate is. So this is why they basically just said, okay, a dog would get 30 milligrams per meter squared. So if we look at the metabolic rate for a bird, for a blue-fronted Amazon, that's significantly higher than a dog, let's just double it, right? So, but again, you got to be very careful. So basically, at that point, that bird seemed to, and when they reported it, seemed to have been doing really well, about a little less than 2 years, a little bit over 1.5 years over it. So that was literally all we could find. So I was a little bit nervous about using a drug in a big animal like this, in a big bird, without knowing the side effects. Luckily, 3 years ago, or before that, in 2005, there was a really nice study of somebody looking at a very similar chemotherapeutic agent, where they really looked at levels in cockatoos. So, and this agent would be very appropriate to use in this. So I said, hey, this is a higher level of evidence. Instead of just making something up that is from a dog, now we have a very similar agent that has been used in another species. Yes, it's not a gray goose, it's a cockatoo, but we all agree that this probably makes more sense than looking at dogs. So, so I felt kind of happy that we have that, because I knew that at that dose, most likely, this seems to be safe, so that was cool. So then I also looked, what are they doing in humans? What are they doing in also dogs? Talking to our oncologist, and they said, well, very rarely do we just recommend chemotherapy alone. And if you actually look if somebody knows somebody that had cancer, even if one of your pets had cancer, actually a shockingly low number of cancer patients undergo just chemotherapy. It's something probably around 20%. So in 80%, adjunct therapy is usually added to the chemotherapy. And this could be either tumor removal by surgery. So surgery could be an adjunct therapy, or something like radiation therapy is sometimes used before we start chemotherapy or after, depending, or even at the same time. So I thought, that's probably a good idea. And the nice thing is that we're treating an area that when we do radiation therapy, which is a little bit like X-rays. I always explain radiation therapy to my pet owners because a lot of times people are very afraid. Is my bird radioactive? It's like, no. So the best way to look at radiation therapy is that you basically look at it like, I always ask my pet owners, like, are you familiar with taking X-rays? Most people say, yeah, X-rays. I know what an X-ray is. I have an X-ray done on me. It's like, okay, so it's basically the same, but instead of taking an X-ray, we're going to take 8,000 X-rays at the same time, right? And then I feel like that's a way how it makes it a little bit more understandable. So it's not painful. The animal is not radioactive afterwards. So you don't even feel that it happened to you. Okay. But what we're doing, we're giving a large dose of energy, and that's basically what X-rays are. We're delivering energy that you can't see to a very, very focused area. And the idea is that with that energy, we're destroying this we're stopping this rapidly dividing cells. So it's kind of like a targeted therapy. And the nice thing is that since it was a leg, we could be fairly aggressive with it, because if that lesion would have been on the neck, or would have been next to the eye, or would have been in the cilium, you then obviously bring quite a few tissues into that targeted area that don't like radiation, like the eye, like the brain, like the heart. So so then you have to dial down the radiation, because you know that you're going to harm these tissues too. And so the heart and the brain and the eye, these are not tissues that can easily repair. But I felt like, oh, we're only going to treat the leg. There's bone and muscle. Man, we can be aggressive. So I said, like, talk to our oncologist. This is how come we, let's do this. And so we found actually a couple of studies, again, presented at these proceedings. So this is why for us veterinarians, it's so important to go to those yearly meetings, because sometimes there's a lot of information presented that potentially doesn't make it into a book chapter, that they don't have time to write it up. It's just one case report sometimes. So this is really important for us to attend these yearly meetings. And then we see this is a huge dose, 72 gray. If you know a little bit, if you talk to a human oncologist, they're like, oh my God, what are they doing? Because it's a lot of energy being given to these. And you know what? The conclusion of this is like, oh, they can be given fairly safe. It's a lot. It's another paper where a 14-year-old cockatoo was given, again, orbital. And so they did an enucleation, so they removed the eye. But like I said before, they couldn't get everything out. So they're going to give another 70 gray. And again, that was an aggressive one. And unfortunately, the bird died 2 months later, but probably not from the radiation, but because of that aggressiveness. So we know they really take radiation really well. So we came up with that treatment plan, and we says, you know what? And that's Boswell when he was bought from the feedlot store. So for $8, I think. So basically we came up, we suggested that, and we said, hey, how about this? We'll do a combination of the radiotherapy. That the idea was the radiotherapy. It wasn't our idea to cure the animal of it, but what we wanted is basically, slow it down. That's what a lot of times what you're actually trying to do with chemotherapy. You're just kind of like trying to slow everything down, and then, or with radiation, and then potentially, hopefully get rid of it with chemo. But a lot of times these treatments are kind of like palliative, which means that, if you want to look at it a way that it's not a curative, so what we're doing, we're extending the quality of life period, but eventually euthanasia might be down the road. But if we get a couple of years out of it, that might be great. And again, I don't know if I mentioned it, but if you would have that diagnosis in a dog, and you would do exactly that, where you would do either amputation of the leg, and you start the dog on chemotherapy, probably an oncologist is going to give you an outlook, a prognosis of like 6 to 8 months of disease-free interval before it's going to come up somewhere else. Okay, so that just gives you an idea. And I said, you know what? We don't know what is going to happen. I'm worried that this is very aggressive, just because metabolically these birds are very high revving, and so I don't know, but let's try it. And the owner said, okay, let's give it a dose. So we started radiation, one dose per week. So we gave 8 gray. That's actually a lot, And then also we started with that dose that has been described in cockatoos, that has been documented to not cause any systemic ill effect. So we felt pretty good about this again. And we did that at the same time of the radiation too, right? So it worked out really well. Before we gave an additional chemotherapy each week, basically we had a quick CBC and chem profile done to make sure that we're not suppressing the bone marrow, that we're not insulting the kidneys too much with this. Because again, like I said, with these chemo things, you're really trying to kill part of the body, but obviously only that system that is replicating really fast. Okay, so and then we continued, obviously, the anti-inflammatories, and gabapentin is a lot of time used for this, especially when we think the nerve might be involved. And obviously, if you played soccer ever, or somebody kicked you against the shin, you know how painful the skin is that is laying over the bone, because that is very painful. So we try to address that as well. Okay, so we repeated that scintigraphy a couple months later, and as you can see, that was our original scintigraphy. Again, the kidney excreting it, the joints, and here you see that, oddly enough, we did very little to that fast moving tumor. Okay, so hopefully you all agree that this is much bigger. So it's progressing. It's really progressing despite our effort. Okay, so right now I would say this would be filed away under a treatment failure so far, because clinically the animal is not doing better. The mass seems to be bigger. So we were all kind of a little bit sad about this. Okay, so but there was no side effect, of the radiation, but the lameness was definitely there worse. So it's not a big deal that we didn't see any side effects, because there were a lot of papers published in the 60s, and those of us who are old enough realized that was the Cold War that was going on. So everybody thought in the 60s, Cuban Missile Crisis and all this stuff, that the Third World War is just happening pretty soon, and everybody did research on radiation. Everybody radiated all these animals, and so a lot of people radiated birds to see what will happen in a nuclear fallout. And so we know that birds seem to be very, very resistant to the side effects of radiation, which was good news. And we confirmed that. We gave a lot. We didn't even see skin sloughing. We didn't see anything locally. So we were able to say, yeah, you can do this. So basically, on the good news, what you can say is like, oh yeah, that mass looks bigger, but we are really not seeing that it metastasized to the liver, to the lungs, which a lot of these lesions love to do. They love to metastasize in organs that actually filter the blood, and the lungs and the liver, some of them. So that's a common site for metastasis. So you could say, okay, maybe if you want to see the classes half full, maybe we were successful in a way where it didn't metastasize anywhere else. We're still dealing with a local disease. So that's the good news here, okay? So obviously there were no problems with the carboplatin that we gave. The liver, the kidney, everything seemed to be doing well. But like I said, because the animal was significantly more lame, it didn't seem to have, that spunk anymore. It lost some weight, so it was clearly feeling unwell. So we already had that euthanasia talk, right? So the owner says, listen here, doc, what's going on? And I said, yeah, I hear you, And obviously as a veterinarian, you're the last person that want to see an animal suffer. And so I said, hey, would you be willing to give us another chance? It's like, because I feel that we haven't really tapped into it to the extent that we could. And I barred it. I said, I agree. This is painful. We try to do everything, but please, I said, why don't you give me 10 days? Why don't you give me 10 days and one more shot, And so we arranged an agreement, says, okay, you can do one more thing, but that's it. And I said, okay, that's absolutely fair. So I sat with the oncologist again. I said, listen, here's the story. And obviously everybody loved Boswell at the time. Everybody was madly in love because this goose had so much personality, right? And so we said, listen, this is the story. And they said, hey, why don't we do this? So why don't we add this one dose, one drug in there? This is the name Pamidronate. And so, and that data is straight out of human medicine, because we know that in human medicine, for those patients that we can talk to, what is the big deal about this osteosarcoma? And they said it's extremely painful, right? They say it's very, very painful. And so, and that's basically that drug. So what that drug does, it actually interferes with one of the cells that actually is responsible for building bone. So if you want to look at that wall as your bony structure, And there's two types of cells that constantly work on a skeleton. So you have the osteoblast, and they're basically the bricklayers that build the wall out. And then you have the osteoclast that kind of like check the wall, remove old stuff, and tell the osteoblast, look, here, you forgot something here. So it's kind of like, it's actually, most people think of a skeleton as a set thing. You grow through puberty, then you have a skeleton, you either have strong bones or weak bones, and that's it. And the skeleton is an extremely dynamic organ. So if you would suddenly start playing softball and you would constantly pitch with your right arm, and somebody would look at the density of your bone in your right arm, suddenly they would see, ooh, that right arm is significantly denser than your left arm. What are you doing? And it's like, well, I joined a softball league and I'm the pitcher, whatever. So it constantly gets remodeled, right? When you get a cast and you don't use your bone for a couple of weeks, you got to go to rehab, right? Because literally that bone gets thin of not being used. Because what happens, our friend, the osteoclast, is noticing, it's like, hey, it seems like they're not using that bone anymore. So why don't we free up a little bit of that calcium and use it somewhere else? So this is a constant kind of back and forth. And that Pamidronate actually inhabits the activity of these osteoclasts, because it seems like that's what's potentially associated with this significant pain. And so again, then just before we did that, there was actually a study in dogs where they have used that too, and they used 1 mg per kg. And in this dog with osteosarcoma, again, it was very effective for bone density. So that's why we came to that conclusion. It's like, you know what? I don't know anything about the safety, but if we don't do anything, it's euthanasia at time. So we don't really have that much to lose. So let's use it, absolutely. So, and that was our last shot here. So, okay. Man, 3 weeks after this, Boswell was walking like a normal goose again. The owner did not appreciate any kind of lameness, you know, which was actually a little bit shockingly surprised that just that one dose did it, right? And so basically that presentation, you know, was kind of original. I presented that at a conference, and that was kind of like after 2 years. You know, at that time, he has received obviously his 24 doses of carboplatin. So we kept him on this because we still thought that it would probably keep it in a little bit of an check position, not to form metastases. And then we had to give him obviously these 20 doses of Pamidronate. So once a month he got his Pamidronate, and he was doing awesome. I mean, the owner did not report anything. He was back to normal. You wouldn't even know that he was sick. So at that time we said, you know what? If anybody diagnoses in the future osteosarc in these birds, you know, I think if I'm going to have that again, this will be my treatment of choice, and I will probably not do radiation anymore. So, and just to show you a little difference, this was Boswell come in like 2 years after his initial presentation, and you can't really see that anything is wrong with him. Either, actually, now that I think of it. Hi, buddy. Hey. So he knew the way where to go. He knew everybody in the hospital. So he became a huge fan of everyone. I don't know, maybe that's just too much anthropomorphism. I don't know if he was ever my fan, but I became a fan of Boswell. Everybody loved him. And then we obviously, this is one of these radiographs taken, you know, a year later in July 2009. And you actually see something very interesting, that actually now this lesion is very easily to see. And what probably happened is that, you know, stopping those osteoclasts, you know, just completely took the fuel out of that osteosarcoma. And it actually transformed into an inactive kind of like just mass sitting there, was clearly not painful again. And the body kind of like went at peace with it. So that was really cool. So basically, you know, he lived for over 5 years with that diagnosis of osteosarcoma, which makes him the longest known survivor. And now, again, I told you earlier that if that diagnosis would have happened in a dog with amputation, with chemotherapy, they usually live for about 6 to 8 months, right? So, I mean, I was so stoked that we got him to like 5 years. He died after I left. This all happened at Tufts University up in the north. So I'm currently in Georgia. So he unfortunately passed away after I left Tufts, and so I think it was unrelated or something. So, but anyway, 5 years out of an osteosarcoma. If you talk to any oncologist, they mean like, this is not true. So if you are interested in Boswell, because I've been talking a lot about it, so if you Google him and you just put Boswell the goose, you'll find actually some of Vicky's Groke's show. He became a TV star because Vicky is a journalist from the Boston Globe, and she focuses on animal topics. She wrote quite a few books. So really good stuff. If you're into animals, I highly recommend it. But basically what happened is she was up at the university, and her big story for the Boston Globe was how these treatments, cancer, any kind of treatment, how we are experiencing this 360 phase where, you know, as we all know, before a treatment gets approved for the use in humans, it always, you know, gets tried out on animals, rats, monkeys, you name it, right? It goes through those phases. And so then it gets approved in humans. And so what her article was like, oh, now the animals are getting full benefit for it again, because after it's successful in humans, then the animals, we read that literature, we use it. And so basically she was sitting in that radiation suite because a dog was treated for nasal carcinoma. And Boswell was the next client. So I just basically walked into the radiation facility, and Boswell, you know, just followed you. He was like this imprinted goose. And I sat next to Vicky. I thought she was an owner. I didn't even know who she was. Boswell sat next to me. And she was like, what is going on here? You're walking in with the goose. And we chatted. I was like, yeah, it's like osteosarcoma, we're treating him. And she said, oh my God, this is fascinating. Would you mind if I include Boswell in a little side story, in a sideline, that not only dogs get treated, but the exotic animals? Like, yeah. And we chatted, and she was so fascinated by Boswell. And long story short, the dog became this little side story. And that whole Boston Globe article, you know, was about Boswell and stuff. And so we struck up a friendship. She befriended the owner, and she had her own TV show, and you can watch this. And it's she has a really great way to look at these things. And the owner who's sitting there, you know, he spent about $40,000 on Boswell for all of these treatments. And so, you know, and one thing in one of the TV things, Vicky said, you know, I really don't want to make it about the money and stuff, but you did invest a lot of money into Boswell. And it's interesting because if you would buy a fancy sports car like a Porsche or whatever, you know, everybody would respect you in the neighborhood, and it's like, oh, look at a successful. But if you invest like a fraction of that money into an animal, you potentially get fingers pointed at you, you know. And so what is that about, you know? And I thought it was very thoughtful. It was very sweet, because emotionally he got so much out of Boswell, and he always said, you know, Boswell is the best dog I've ever owned. So it was just great to be part of that team, and I'll definitely never forget that case, you know, for the rest of my life. So again, if you go online, if you just go Boswell Goose, you'll find it. So if you wanna spend 7 minutes, and there's a couple of different episodes, go ahead. So again, aha moments for this. Again, I think scintigraphy is great, and the interesting thing, you know, scintigraphy, even though it's super like unusual, and you may want to say weird or whatever, because you're injecting radiographic, but most of the time those facilities, I mean, we only charge like something like $200 for it. So it's actually just a little bit more expensive than x-rays, you know. So it's not that we're talking about $2,000 for that. And a lot of times it gives you a really good idea where the lesion is. Again, I think that chemo protocol is really great. And like I said, I will probably use that in the future, and I can highly recommend this, and hopefully my colleagues will so too. And again, we know that birds are exquisitely tolerant of radiation. So even though I personally love radiation, I use it in a lot of cancer patients, I probably will not do that in the future. So for this thing. So and then the other cool thing is, you know, osteosarcoma, avian osteosarcoma might be very, very different than mammalian. And so, you know, if you get the right oncologists in the room, and they share their knowledge and talk about it, you know, maybe there's some kind of answer in how to treat human osteosarcoma, in how the avian osteosarcoma acts and looks like under the microscope. So basically, I've been going on for over an hour. I'm sorry. I think you guys probably only thought I'll be back in 25 minutes. So, but basically, do we have any questions?
Well, I have a question for you, Dr. Mayer.
Sure.
So what was the total time span for Boswell's treatment, like from the day he came in to the day he was discharged, so to speak? How long was that course that you were?
So yeah, so he came in the morning usually. So, and one of the things was that we elected not to start the treatment until we had the blood work back, right? So we got the blood work early in the morning, then we had to wait a couple hours for the blood work. So let's say we got the blood work back at 11 or something like this in the morning, or at noon, and then we went ahead and do the treatment. And then we gave these infusions over a couple hours. So you wanna give these treatments very slowly, because again, if you push them too hard, and then too much ends up to be obviously in the liver, in the kidney, you know, again, think about it. This is very toxic to the system. So you have to do this very slow. So we gave an infusion, and then basically until it's a university, there's paperwork involved and everything. So basically he came in the morning at 8 o'clock or something like this, and he went home at 5 o'clock in the afternoon.
Oh, wow. And so this is pretty specialized treatment. So would this be typically something that you would find at a university hospital, at a veterinary hospital, not like your local vet? It'd be more like you'd be referred from your vet to like a university hospital, or?
Well, I mean, that's a cool question, because to be honest, the vast majority could have been done in a private practice. You know, I mean, you have radiographs, you know, maybe, you know, obviously the scintigraphy told us like, ooh, this needs to be happening right now. So, but, you know, anybody that sees birds would have been able to take that bony biopsy, you know, because again, that was not a difficult surgery because it was on the leg. So you didn't even have to open the body cavity. And then, to be honest, he was put on these IV medications. So all you have to do is place an IV catheter. So the tricky thing is that, you know, these are chemo drugs. And so handling of chemo drugs requires another level of, I want to say a little bit like paranoia, because when you break those vials open, you don't want to inhale the fumes. You know, you have to transfer it from the vial into a syringe underneath a hood. But you know, some referring practices have that. So, and then they could have done these monthly treatments. So, I mean, you know, there's a lot of stuff that could be done outside of a university, that's for sure. It just depends on equipment, what they have. Do they have a hood? Do they feel comfortable handling a chemotherapy agent? And then, you know, do they have enough time to sit with an animal that gets an IV over 3 or 4 hours, because that takes manpower. And, you know, at the university, we do have that. So.
Okay. And I have a couple questions for you. Let's see. First off, oops, sorry, I just got my window here. Okay. So Daniela asks, what are the most common types of cancers in parrots? How often do you see these in parrots, and what is the prognosis? Is cure even possible with any cancer type for parrots in particular?
Okay, so I just want to give you kind of like a perspective. So just exchange that word parrots with humans, and you know that it's close to impossible to answer that. You know, it's like, what kind of cancers are there in humans, and can we cure them? And so yes, we're dealing with a lot of different species. Human is just one species, but man, I have seen so many different cancers, you know, the chapters are still being written, you know, and so you can have a lymphoma in a bird. You can diagnose a lymphoma that you can treat, and, you know, maybe treatment involves a pill orally twice a month, and that bird could live for 2 years. And you can have a lymphoma that is like in the same species, looks like the same lymphoma, and you start that bird on it, and that bird is dead within 2 weeks. So same cancer, same species. It's one of those things where, like I said, I've been doing this for close to 25 years now. And you know, it's like there's never the day where I say I've seen it all and I know it all, and somebody ought to euthanize me, because, you know, then clearly something is wrong, because these, you know, these cancers, they kind of do what they want sometimes. And like, so for example, to be honest, if you look at this case alone, this was classified as an osteosarcoma. just by the clinical behavior, it doesn't fit the bill for a sarcoma. You know, there's no, like, without removal of the primary lesion, without amputation of that leg, with just chemotherapy, and then that Pamidronate isn't even considered real chemotherapy because it just slows down these osteoclasts, to get an animal to be alive for 5 years. I mean, to me, it's amazing. So would I go out and I would say, like, maybe next week I'm going to get a sulfur-crested cockatoo with osteosarcoma, you know, and would I go to the owner and say, nothing to worry about, you know, because I got this, we invented a protocol, at least for the next 5 years, you're good? Oh God, no, you know, oh God, no. I think if we have 40, 50 cases of osteosarcoma in a species, if we have 40 cases of osteosarcoma in a gray goose, and you know, if we have 50 cases and 45 of them live to be 5 years, then I would feel like, you know what, seems to happen in gray geese, seems like that we probably get 5 years out of it. But like I said, the next gray goose with osteosarcoma, it could be that I'm going to lose that patient despite that same protocol in two weeks later. So this is really a loaded question. I know I'm hedging and everything, but everything else would be just me making stuff up.
Okay, appreciate that. So I do have a question from Jeffrey. He asked, is there any way to recognize avian pain? I understand the secondary symptoms: anorexia, lameness, lethargy. Anything else?
Yeah, that's a really great question, and I think we're also just scratching the surface. And if you look at these studies, there's where they actually look at efficacy of analgesic medications, depending on which institution is doing the study, they all have a little bit of their own idea how they monitor pain. So, you know, there's the perching, that they observe the perching. There is the one where they sit on a hot perch, where basically they perch and then they can remotely increase the temperature, and then they see what is the temperature point when the bird actually does the little dance, because that seems to be at least uncomfortable. There is, you know, I mean, there's behavioral factors. So again, my thing is that I like to really focus on appetite. I really like to focus on, this is why I always recommend, you know, you get a pet, you know, while you're in the pet store, while you're there, buy a scale, you know, or you get a perch and somehow figure something out how this could be on your baking scale. Get a postal scale and get in the habit of every month, at least minimum every month, better like once a week, every Sunday, have your bird sit on that scale. Because to be honest, some of these signs are very subtle. And one of the things is that you notice that if they don't feel well, there is going to be a decrease in appetite, right? And to me, if the animal is lame, if the animal doesn't want to perch, maybe it wants to sit, maybe it wants to look a little bit, is a little bit more sleepy. But if you put that sunflower seed bowl in front of it and he goes bananas, you know, then I know the quality of life is probably not horribly. So, but if you put the sunflower seed, AKA the avian cheeseburger, in front of it, right? And they're kind of like looking at you, kind of like sad, you know, this animal is not feeling well. So I think for an owner at home, monitoring body weight is really important. And I mean, to be honest, that's what I do with my students. When a case comes in for a recheck 2-3 weeks after the initial exam, and there's like, well, Fluffy seems to be doing okay, or, you know, Tweety Bird, my first question is like, what's the body weight in comparison to 3 weeks ago? I mean, that's literally kind of like they already know. And then I teach them not to give me an absolute number. I don't want to hear 94 grams, because that really doesn't tell me much. But I want to hear, oh, he lost 5% of his body weight, right? Because I don't want to hear Fluffy or Tweety Bird lost 5 grams, because if I deal with a hyacinth macaw, 5 grams means, oh, he just pooed in the waiting. Versus if I deal with a finch, 5 grams is suddenly like a significant amount of the body weight. So this is why I train them. Get in the habit of expressing it. And if you call me as an owner and say, I'm really concerned about my bird has been losing some weight, I'm going to be asking you, how much percent? right? So, or if you tell me he lost 5 grams, my question is like, well, from what? From a kilo or from 48 grams?
Okay, so they should have a basic idea of what their bird's body weight is and keep it.
Yeah,
and
to be
people that's
honest,
going to weights, like write it
and to
down.
be honest, I'm sorry. I always say that, you know what, you as an owner, I always say you are the best judge of the quality of life, because you may have a morning shower routine, you may have a morning wake up call, you may have something that God knows what it is. It's maybe your secret and a bird. Birds are a creature of habit, right? If that bird is not responding to you, alarm bell should go off, right? If that bird is not doing its morning routine or his good night routine or whatever it is, like maybe one day, maybe one morning, I'd be like, okay, you know, whatever. But in the evening, that routine should be back. If it happens twice in a row, you better call that veterinarian, because you don't want to wait the 3 days.
Okay, good advice. And then Jeffrey asked another question. Did you have to anesthetize Boswell for treatment, including the x-rays? Like how often did you have to anesthetize him for some of these?
Yeah, so what we do is we actually, we don't really anesthetize a lot of birds anymore. We actually heavily sedate them. So we use a drug called midazolam, which is, you know, very similar to diazepam. I think in the 70s it was called Mommy's Little Helper, something like this. So it's a benzodiazepine. I had surgery too on my knee, and man, they gave me this stuff before the surgery. Best thing, because while it's not, you know, obviously an anesthesia event where you have to worry about, you know, do I need to keep the bird warm because it doesn't regulate the body temperature? Is it, you know, because literally all these brain functions are turned off. Our sedation protocol basically lets them be very quiet, sleepy, so we can take a radiograph, so we can place an IV catheter. And like I said, if you place that IV catheter for chemotherapeutic agent, it has to be 100% perfect. If there's a drop of that stuff spilling out of the vein, it could literally eat the leg away. I always compare it to, like, it would be like battery acid. You know, like think about injecting battery acid into the bloodstream. It gets diluted immediately. Yeah, it's nasty, but like the worse is battery acid underneath the skin. Yeah, you're gonna lose that finger, lose that arm. And so you don't want that animal to move, even when you're pushing their throat. So what we do is we just give them good stuff. So they're chilling. I always say they're listening to Jimmy Buffett or Pink Floyd, and they're doing well. And you know, you don't have to worry about the body temperature dropping. You don't have to worry about cardiovascular depressing effect that the heart rate goes down. So we do the vast majority of our stuff under sedation.
Okay, and then I think a final question from Claire asks, are there any known risk factors for avian cancer? Like, is there any I guess, risk factors that sets them up?
The question.
Are there any risk factors that might increase, let's say, a bird's chance for cancer? Like, is there any lifestyle things to follow up?
I mean, I think,
I mean, like with humans, you know, if you keep an ideal body weight, you know, eat right, exactly, exercise, all that.
That's where I wanted to go to. You know what? I think all the other stuff is so much more toxic. So, you know, that we kill them with being obese, then they die of arteriosclerosis. They die of non-cancer related things if we somehow do maintenance or husbandry, if we don't cater to their needs, if we shower them with love and we give them too many calories, if we do this, they're coming down with metabolic diseases. So we either send them in renal failure, we send them in liver failure, we send them in arteriosclerosis, they get a heart attack. But inducing cancer, I have a hard time right now at the top of my head thinking of something where I say, oh, don't do this, because you're clearly going to end up having a lymphoma at the end of the day. So I really can't think of anything, because metabolically my concerns are more that way.
Okay, and so I have one final question, promise. Jeffrey asks, would you please explain where the 4,000 went for Boswell's treatment? Chemotherapy, how expensive is that?
Yeah, so that's a great question, and to be honest, it's again, the question chemotherapy, how expensive it is, like it really depends on what agents are being used, because sometimes sometimes because we're using, obviously the vast majority of drugs that we're using coming from the human market. You probably here and there hear in the media these scandals, how a drug that used to cost $30 suddenly is now costing $13,000 for one vial, right? So we are directly dependent on those costs because there's very little that is specifically manufactured for veterinary oncology cancer stuff. So we are a little bit at the mercy of the costs of the human, and they are highly fluctuant. And sometimes one vial that you can, even if you only use, let's say it's a 100 milliliter vial, because that's what they use in an average human. And even if we only use 1 milliliter, we use only 1% of that vial. The moment you open it up, the moment you suck it in a syringe, and then you have to give it over 3 or 4 hours, that's it. Because what happens, oxygen hits that drug, right? It starts to oxidize, it starts to change the molecule. Sometimes it changes color, and you literally have to throw that vial out, and it might cost $700. And, it's horrible. And you can't freeze the drug. So we know a lot of drugs that we can freeze, and we do that, obviously. So sometimes an owner has to purchase an initial vial that maybe costs $400, but we say, you know what, that's that initial. This $400 is going to carry you through the whole year, because we can keep it in the freezer for a whole year, something like this. So, but yeah, imagine every time Boswell came in, he got full blood work, which at the time was probably close to $200. Then, the sedation, then the IV, it's just a catheter, the IV placement, everything. So add another $100. And then the oncology drugs, and then there's another fee for oncology drug is a little bit more expensive, because they can't be disposed of as normal drugs. It's like biohazard waste, so there's an additional fee. So, and because this has been going over 5 years, so he spent probably $1,000 a month on this, which is very reasonable for such a complicated and difficult to maintain procedure. Yeah.
Oh, it's fascinating. Too bad they can't have those in little avian-sized vials.
I know. It just breaks my heart too.
Yeah. Wow. Well, thank you. I think that's all we have time for today. Thank you for taking that taking us on that journey. That is. I'm glad that Boswell was able to live a long and happy life, and it looked like he had a great time visiting the clinic. So you guys obviously cared for him very well. So thank you for sharing that with us.
All right.
And so again, thank you, Dr. Mayer. That was extremely informative and touching at the same time. So just to let our viewers know that we do have another webinar scheduled for next Friday. We will have Dr. Heather Barron, and she will be talking about the pros and cons of alternative medicine, what you need to know for your bird. So until then, just want to say bye to everybody. Thank you for joining us today. Again, thank you, Dr. Jörg Mayer. Thank you. And in the meantime, everyone, stay healthy, stay safe, and all the best to you and your flock. Bye.
Bye.